We have a guest in the studio. We're going to be talking a little medicine. In fact, at some point, if you have a question or comment as well for Russell Singleton, he's a physician assistant from Trip Family Medicine here in Twin Falls. Feel free to give us a telephone call at 736-0300. Bill Colley with you as well this morning on Better Health with Trip Family Medicine. 25 right now at 8:33. Russell this is his last visit of the calendar year, or are you here next week?
No, you're gonna get to hear Jeremy next week.
The rotation
That's
continues.
right.
Well, first of all, welcome back.
Thanks.
Been a few weeks since we've seen you.
Yeah, it has, but I'm glad to be back here and to have a chance to talk with everyone and hopefully hear some opinions.
We
So,
we had a little off-air conversation because you had sent me an email. I mean, gosh, you were up very very early this morning. Must be you have kids in the house.
yep.
But you referenced paternalism and patient rights. And what do you mean by paternalism?
Well, as a parent and as a medical practitioner, I think I understand paternalism to be the idea that the patient or the child is in such a situation that not only do they need some type of outside help, but they also are in a position to really not understand why that help is needed and when or how it should be applied. So as a parent, when you're caring for a child, you don't take a lot of time to explain, and perhaps we should, and that's what we're going to get into. But you don't always explain yourself. The parent knows best. Sometimes the child just cannot comprehend the decisions that are being made or why we do things. So a paternalistic individual just steps in, makes the decision, and takes care of the child. And medicine traditionally, going back hundreds of years, has been very, very paternalistic, meaning that the physician or the practitioner knows best, and the patient just needs to kind of lay there and let the physician do what needs to be done. But that is shifting. It's changing. We talk a lot these days about autonomy, which is on the other end of the spectrum. And I guess we'll talk about today how neither one of those in their purest form are are good. Patient autonomy can actually lead to a lot of poor outcomes, just as a pure paternalistic relationship can too. So hopefully today we'll talk a little bit about how we meet somewhere in the middle, a paternalistic provider, a provider who operates on beneficence, and then uh, also one who respects the self-governance of a patient.
Growing up in a small town, the same doctor delivered my brother, sister, and me. And then he was still my doctor until my early 20s after I finally graduated college and moved away. But he was a very quiet man. I mean, he was nice, but he was very quiet. And I remember one day asking him a question in the office, and he suddenly stopped and he seemed surprised. Then he pulled up a stool and answered the question and started talking with me. And then he reflected that nobody ever asked him questions in that situation because they were so used to that old paternalistic system.
Well, I hope you remember what the question was.
It's been 30 some years.
but but that brings up a good point. From the minute that medical students, PA students begin their education, we're taught at least maybe not intentionally, but we're taught to make decisions in a vacuum. That we look at this disease model, the germ theory of disease, and we're taught to dial it down to its most basic components, find what's causing the problem, and correct it. But oftentimes, we make those types of focused decisions at the expense of the patient as a whole. We forget to think about how that patient lives or functions in society, in a family unit, and I guess the goal of the conversation today is to bring to light the patient's desires, their will. Sometimes what we want for a patient and what we think is best for a patient is not what they want. And that is where paternalism has to find its limits because I am and have always been, and after some recent experiences that we might talk about, am more of an advocate for patient autonomy, even if that does lead to some bad decisions. Because I think that's what I think that's the purpose of autonomy, and we could get a lot further into that, but I think you deserve to do some stupid things every now and then.
Some people, I mean, obviously make decisions about their own treatments I knew an old clergyman many years ago, and he just made the decision when he discovered he was going to have cancer that he wasn't going to, he was going to accept it and accept his fate. And he even avoided painkillers and the like, and said he welcomed the suffering. Now, that's a you don't expect everyone to do that, but there's an individual who decided that he was going to take some autonomy and make that decision on his own.
Yeah, end of life decisions are a great example. I think in healthcare, we sometimes have this technological imperative, meaning that if there is some test, some procedure, some intervention that could potentially prolong life, we must use it. We must employ it. And that ignores, unfortunately, a patient's desire to not only direct the course of their own life, but to prioritize quality of life over quantity of life.
We've got more coming up with Russell Singleton from Tripp Family Medicine. Russell is a physician assistant, and of course, Tripp Family Medicine is located on Fillmore Street in Twin Falls, on the north end of the city, directly across from the main post office. We'll have more details on getting in touch with them in just a few minutes. It's 8:40, 23 right now. Bill Colley with you as well on Top Story this morning on News Radio 1310 KLIX and newsradio1310.com. Joining us in studio is Russell Singleton. He's a physician assistant at Tripp Family Medicine here in Twin Falls. Bill Colley with you as well. And of course, if you'd like to reach Russell this morning, you've got a question or comment about actually some of those choices patients may make. Telephone number 736-0300. That's 736-0300. You know, we talked a little bit about some specifics when it comes to that, but you were referencing sometimes people do make some poor choices. And so you say autonomy is a good thing, but there are sometimes people just, well, there was a woman who called Rush Limbaugh's show a few months back, and she was talking about her husband who's 57 and never been to a doctor since he was an adult. You might say that that's autonomous, but it's not necessarily the the best approach.
Absolutely. That is another great example. Um, I think when it comes to personal individual health decisions, I think patients need to try and become as informed as possible. And that's where we come in. We can try and teach them, educate them, help them understand what the risks and benefits of these different decisions might be. But then autonomy and paternalism meet when the patient may or may not be able to fully understand the risks and the benefits of their condition, especially within 15 minutes. And is a person truly autonomous when they're ill, when they're not in their best, they're not their best selves. So how then do you respect a patient's autonomy while not accusing a physician of doing less than the best or offering less than the best? I've been in a lot of situations where I have made recommendations to patients for whatever reasons, usually in chronic care situations, not acute care situations, because I think I'll have to admit that in an acute care situation where you have a significant compromise of that patient's autonomy, then thankfully, at least for a short time, paternalism takes over. We do what we think is best, what we think the patient would want, and then hopefully, as the scales change, as the patient is able to exercise more and more autonomy, we become less paternalistic. But I've been in situations where I've recommended certain things and told the patient that I thought it was in their best interest, and they have said no. So it was then up to me, I guess, to either argue that point, to get offended, to fire them as patients, to choose to dedicate my time and invest my time elsewhere, or simply respect the fact that if the patient does not want to take that extra medication, even though it may be recommended, if they don't want to get the particular screening at the time it's recommended or at all, there's nothing I can do about that. And I shouldn't be offended because I believe that that patient has every right to make decisions regarding their own health care and that we should celebrate that instead of chastise and belittle patients who choose not to follow our every recommendation.
Also, you have people sometimes they have their religious reasons, and I know that I grew up in an area where we had a heavy Amish population, and occasionally you had outbreaks of what was called whooping cough, pertussis, in those communities, and it was related to the fact that they had, very, you want to talk about autonomous views when it comes to medicine, and so there was always the argument going on between the state and these communities about how far the state could push them to bring the children in. Uh, that's a huge one that's still going on today.
Yeah, and I have to admit though too, Bill, when it comes to public health, I think I'm a little bit more liberal because one's decisions now not only affect themselves, but can affect others around them. And I don't think you can really call your actions or decisions in that case an expression of your free will, of your autonomy, when by extension you are limiting or damaging the autonomy and liberty of someone else. If you have a communicable disease, you may feel like you shouldn't have to get it treated, except if you're spreading that disease and causing others to become ill and suffer, then that I think needs to be regulated a little bit heavier. And so, if you want to talk about immunizations, for an example, I'm not sure how I feel yet. Idaho has one of the lowest vaccination rates in the entire country, and it's because Idaho not only allows for religious exemption, but ideological exemption. You don't have to claim a religious uh, prohibition on vaccines. You just have to say you don't believe in them, and we can't really force it otherwise. I think the schools may have standards that they're now starting to adopt, but medically speaking, we can't force that.
Now, the other part of this argument too is in a family practice, you can have a different approach to medicine altogether when it comes to patient autonomy. Whereas I don't want to call it assembly line, I'm trying to find a better euphemism for that. But you have a lot of the larger practices, and I'm sure the people there have instructions. This is how it works,
Yeah.
and so therefore you don't have the liberty in those larger practices, corporate practices, that let's say you would have a Trip Family Medicine.
That's a great segue into talking about why small family-owned businesses, I think, have a great advantage over larger institutions because we are the ones that develop our own policies and our own procedures. Unfortunately, medicine is still in a state where governments and insurance companies yank us around and yank patients around and pull out medications out from under them when they've been on them for for who knows how long. But as practitioners, we follow Dr. Tripp's direction as PAs and Crystal being the NP, but he also gives us the ability to inject our own autonomy and our own personalities, and I think he trusts us to follow those best recommendations. But when it comes to medical decision making, Dr. Tripp is the ultimate authority. We're not beholden to councils or boards or other policymakers as much as those in larger institutions. We do things the way we want to, and that's the way medicine should be practiced. It should be practiced at the lowest, uh, most local level. The further you get outside of that doctor-patient relationship, the muddier and costlier and more ineffective it gets.
I want to point out it's 10 minutes away from 9 o'clock, and Russell Singleton, a physician assistant from Trip Family Medicine, joining us in studio this morning. We've got 24. Bill Colley with you as well on News Radio 1310, KLIX, at newsradio1310.com. And of course, we call it Better Health with Trip Family Medicine. Just a quick note, I just wanted to pass along a mention. I dropped a Christmas card to them in the mail the other day. I don't know if they got it or not, but Waddell and Reed in Twin Falls has been in business about 80 years, coming up on an 80th anniversary, one of the oldest firms in the country to offer mutual funds, and they do something rare. They offer two, which is not what you'd call what is a general practice in investments. They have a conservative nature, and they'll work with you as an individual. And as an individual, you have different needs and different wants than, let's say, your neighbor has. They build plans to meet those needs and goals, and they help you manage money and take planning personally. Now, speaking of people on the local level, Trip Family Medicine is a is well, we want to point out, easy to get to. First of all, if you're on Pole Line Road, you're a block and a half away from Pole Line Road. If you're shopping in the district up there in the Winco area, Target or whatever, you're just behind that a
That's
block.
right.
And so anybody coming even off the highway from 93 or from Nevada, These are people who have an opportunity to pop in the door. And we're just talking about a business in town that has a good reputation, and you can tell by how big it gets and how long it's been around. Trip Family Medicine is growing by leaps and bounds, to the point where you're going to probably knock the walls down in that building just to survive.
Absolutely. And I would add to that too that as a traditional family practice, we're not an urgent care per se. We're still a family practice, but we do offer same day appointments to existing patients, but even to new patients when they have urgent needs. I don't think we're really offering those same day appointments to people who need their colonoscopy done right now. But if you're sick, if you've got a cut or a scrape or a bump or a bruise, we do prioritize those same day appointments that we have available. And so the best thing you can do is call and call early.
Speaking of callers, we have a caller with us at the moment. Caller, you're up next. You're on the air with Russell Singleton from Trip Family Medicine.
Hi, I was just wondering, does your office have an X-ray machine?
That's a great question. We do not have an X-ray machine currently. We are looking at a couple of different options, anywhere from getting a portable service to come in versus just having one in-house with an X-ray technician. Right now, we utilize a couple of different resources. We're about a block or two from the outpatient imaging for St. Luke's. There in the Renaissance Center, and then we also have, I believe, it is Allied Imaging that I think they're right behind. I'm gonna hesitate to say it because I don't want to mess it up, but they're right in the Twin Falls area, and we're able to do not only X-rays, but I think even ultrasounds there for people who want to patronize an independent group.
Caller, does that help?
I guess my question is, if I can't get into the orthopedics for my son, he thinks he has a broken wrist, and so I just didn't know where I could go. They're all booked up for the whole.
Yeah, yeah, absolutely. I think we would absolutely be able to help you because in that case, I think what you're waiting on mostly in that situation is not the ability to get an X-ray, but it's the ability to see a physician. Well, we can see you, like I said, usually same day, if not the next day, and we order that X-ray on an outpatient basis, which is much easier to obtain. We give you a requisition. You oftentimes go right down to the imaging center there on College. You don't even need an appointment. You just walk in, they snap the X-ray, and then they send it back to us within a day or two. So it is a little bit longer as a result. But even just from the initial consultation, we can give you a pretty good idea about whether or not there's a sprain or a fracture. We get the patient set up in a splint and pain control, everything that would be done during an orthopedic evaluation. And then if there is a fracture, especially a complicated one, we'll oftentimes refer you back to an orthopedist to make sure that you get the best care possible. And then even when we make that referral, I think hopefully we're able to expedite that process a little bit versus a patient who calls in on their own.
Thank you very much.
Yeah, thank
I
you.
want to thank the caller too as well, and 7360300 the number. Got about 4 minutes to go. One thing we should talk about with patient autonomy, because of the way modern medicine has developed over the last 40 years since HMOs were created, and now we've got government. It's grown in its involvement. You're not being political, but insurers sometimes, I'm sure, want to have more control over this than the patient has.
Yeah, it's absolutely ridiculous. I don't want to say anything I'm going to regret, but I've got there's no love lost between me and insurance companies. Unfortunately, I feel like they direct care oftentimes inappropriately when in reality they ought to be insuring against disaster like any other insurer. But then it would be up to us to make care affordable so that patients don't have to worry about, well, can I do a copay here? What's this going to cost? Does this go to my deductible? I think uh, to get slightly political and then hurry and change the subject, I think we need to remove insurance from the basic practice of medicine. I think it needs to be a catastrophic coverage for catastrophic illnesses, and then we need to find a way to make medicine affordable so that patients can regain control.
I was going to say it's been a constant fight for decades, and there's pushback here and there. But I think that as time goes on with an older population and as government tries to figure out an answer to all of this, there are always going to be some restrictions on what the patient can do when it comes to decisions, especially who they see and the like.
Yeah, and this may not be exactly what you were getting at, Bill, but if we follow that idea of patient autonomy and take it to the other extreme, I think we find a system that is just as problematic as one that is completely paternalistic, because then the healthcare provider is really no more than a short order cook. And the patient walks in and says, okay, I have X, Y, and Z, or sometimes they don't even tell us what they have, but they say, I want A, B, and C. And if it's reasonable what they want, then I'm inclined to to give that to them as long as it's not going to cause them any damage. But sometimes requests can be quite inappropriate. The two most common requests that I get inappropriately are probably for antibiotics when someone has a viral illness, and I really do feel like it would be to their detriment for me to give that to them. I have to explain how it would probably give you some diarrhea, it'll mess up your gut flora, it could cause an allergic reaction, potentially life-threatening, and every time you take these antibiotics, they work less and less. So please don't use this inappropriately. Don't ask for it inappropriately. Let me help you make that decision. And another one would be pain management, which is something I'm very empathetic towards, but sometimes people who may or may not have long-standing addiction issues will believe that it's in their best interest to have heavy doses of narcotics over and over again. And that's another example of something that we just we can't provide.
Before we wrap up, quickly, contact information. You're on Facebook, the web, and have a telephone number at the office.
Absolutely. Call and talk to any one of our lovely front office staff, 933-4400. They can get you in hopefully the same day or the next day. But again, it depends on what the issue is. We're trying to prioritize people that have urgent care needs, and we hope to see you.
Want to thank Russell Singleton. We'll see him after the new year. Right now, it's coming up on 9 o'clock, and Russell, Kelton Hatch. Sometimes I get my guests confused, even when they're sitting in front of me. Kelton Hatch from Idaho Fish and Game coming up after 9 o'clock news, right here on News Radio 1310 KLIX and newsradio1310.com. And we're at 24. I know that may not sound great, but it's a darn sight prettier than what we saw earlier this week.